Hi, I'm Dr. Rosina Badal Munir, and today we are going to talk about the ultrasound guided central venous access with Sonon 300L. A six-step systemic approach for central venous access includes the pre-puncture identification of the anatomy, assessing the target vein, such as looking for the anatomy and the vessel localization, looking for the vessel patency in order to exclude the venous thrombosis. And then to select the site of the insertion, the spot where the puncture should be made, and then using the real-time ultrasound guidance for the puncture of the vein, and lastly the confirmation of the needle to confirm the correct needle in the vein. The advantages of the ultrasound guided central venous access result in the decrease in the rate of arterial puncture, hematoma formation, and the number of attempts and the time until the successful cannulation, and in an increase in the success rate with the first attempt of puncture. The preparation of the guided procedure includes the aseptic technique, in which we use the sterile probe cover or plastic sheath. So here we are using the Sonon 300L, which is a linear probe, and it is a handheld probe, and it fits entirely in the probe cover. So in case of using the probe which has a cord, so it is very important that the probe and the cable should be in the sterile sheath. So this is very important. And use a single use sterile gel packet. Proper patient positioning and exposing the neck area properly are some of the more steps to remember while you are doing the preparation for the procedure. The position of the operator is very important, and it should be such that he or she has the insertion site, the needle, and the ultrasound screen in the line of sight during the needle insertion. Usually, the operator should hold the ultrasound probe with the non-dominant hand, and while advancing the needle with the dominant hand. So this approach is referred as the single operator technique, and it allows the operator to optimally align the ultrasound plane and the direction of the needle. So now if you look at this cartoon, so the operator is standing on the head side of the patient, and then the non-dominant hand is here, which is holding the probe, and the dominant hand is performing the procedure by needle insertion. And you see that over here the everything is in the same line. So the screen, the monitor, and the patient positioning and the procedure. So this is a very important step when you are performing the procedure for the central venous catheterization. Now the ultrasound probe is placed in a transverse position relative to the vessel, resulting in the short axis view on the ultrasound screen. So identify the sternocleidomastoid muscle, the common carotid artery, which appears as a rounded circle with the arterial pulsation. On the top of that, you will see the internal jugular vein, which is seen as a greatest diameter. It will be having a thin wall, and you will see the pulsation with the respiration. Orient yourself with the indicator position on the screen or on the monitor. You see this is the indicator, and the marker on the probe. So you see the marker on the probe is on this side. So orientation is very important, that the probe marker and the marker on the screen or the indicator on the screen should all be in the same side. This is very important, otherwise you will have the confusion of the left and right side, and when you will move the needle. So the easy way to check the orientation is to tap. So if you tap on the side of the indicator, so at the same time you will see a turbulence on the same side of the monitor on the screen. So this is the best way to check the orientation. So this is the transverse view of the internal jugular vein, and this is the common carotid artery. So this is the long axis view, which is obtained by placing the probe in the longitudinal plane. So here the probe is along the parallel position to the course of the vessel. The internal jugular vein is seen right above the common carotid artery, and it shows the pulsatility. So you see the change in the size. It increases and decreases with respiration and also with the valsalva. So note the thin walls of the vein, and here are the valves of the vein. So in this position, check for any thrombus, look at the patency of the vessel, collapsibility, and compressibility. Now we will come to the selection of the insertion site and the technique used for the catheterization. There are two types of techniques adopted by the operator for the central venous catheterization. One is the out of plane and the other is the in plane technique. So in both the techniques, ideally, the first you have to find the spot in the short axis, so where the internal jugular vein is adjacent to the common carotid artery. So it should not be on the top above the artery. So for that you have to scan in the transverse direction so that you find the proper position or the proper spot for the catheterization, and it should be adjacent to the common carotid artery, because this will help you to not to puncture the common carotid artery. So for puncture, the internal jugular vein should be in the center of the screen. Align the needle in the center of the probe and insert the needle close to the probe with at least 45-degree angle. While advancing the needle, its tip should be constantly identified with the ultrasound during the needle approaches to the vein. You will hear a pop when the needle punctures the wall of the vein, and you will also see the indent in the wall. You see the bevel of the vein of the needle in the vein. So once the needle is in place, you move the guide wire smoothly in the vein more proximally. So be careful, the needle may not touch the posterior wall of the vein. Most of the time you see the retrograde blood flow when the needle is in the vein. So in the short axis, the needle is only visualized as an echogenic point, and this is the out of the plane technique. But when you're using the long axis, which is called the in-plane view, the entire needle is seen in its complete course, and the depth of the needle tip can also be seen on the ultrasound image. So this approach reduces the risk of penetration of the posterior vessel wall. But again, it depends on the operator that he or she adopts the out of the plane technique or the in plane technique. So now the last step in the catheterization process is to confirm the entire course of the catheter within the vein. So this is a catheter within the vein. So remember a few of the tips: that look at the vein when the needle punctures the wall. Avoid puncture close to the clavicle. Be careful not to puncture the pleura, as it may cause the pneumothorax. Check the depth of the vein below the skin on the monitor. So this will give you an idea for the selection of the proper needle length. While performing the exam procedure, view the artery and the vein simultaneously, and look for the nerve, as you may not insert into the neurovascular bundle. So with this, we are done with this tutorial. Thank you for your time and attention.